Hello, and welcome to this training module for the Wellcal and Suretemp Plus thermometer. By the end of this training, the user will be able to operate the device in a safe and competent manner. They will have an understanding of the application and function of the device. They will demonstrate how to attach a probe cover and obtain accurate oral or auxiliary temperatures, explain the differences between normal and monitor modes, and be able to care for and clean the device properly. So on to our patients. The expected body temperature is around 37 degrees Celsius. The range of normal is dependent on a person's age, gender, medications, time of day, and level of activity. So first things first, we inspect for damage, where faults, and check it's within its service date. If it's not, do not use and return it to MESU. So onto the parts of the device, you have the LCD display. We have the probe cover box, which is invisible in my case. A removable probe well. And you have a latching probe connection. You squeeze that and pull, it should come out. You have a disposal button for getting rid of your used probe covers. If you take a look at the back, there's some indentations. If you squeeze them and pull, it should lever to reveal the batteries. And that's how you take the thing apart. So removing the probe to turn the machine on, there's a Celsius and Fahrenheit on the left. Switches between Celsius and Fahrenheit, obviously. Now, they might not be able to work on every model as most it is locked. So, putting the probe back into the well, press and release the pulse timer button at the top middle to activate the timer. Audible beeps sound at 0, 15, 30, 45 and 60 seconds. The timer turns off automatically after 60 seconds, although it can be stopped at any time by pressing the pulse timer button or by removing the probe from the probe well. This facility is useful for timing pulse and respirations. So on to mode selection. If you press and release the mode selection button after withdrawing the blue probe from the probe well, to change the current measurement from site from oral to auxiliary or pediatric auxiliary, and the selected measurement site is displayed by the flashing body site icon. And to recall, press and release the recall button whilst the display is blank to recall the last completed predicted temperature. The LCD will display the recall temperature for 5 seconds. So recalling back to our mode selection and our patient groups, adult is 18 years and older, pediatric is 17 years and younger, not sure what you do for people in between those ages, and for auxiliary readings in those age 17 years and younger, you must always use pediatric mode. Normal or mode, adult, is the default operating mode for temperature measurements. In normal mode, the temperature is measured at discrete intervals and then calculates a rate of change according to a proven algorithm, and this allows the thermometer to predict the endpoint it would reach if it were left in the mouth until the reached mouth temperature. This predictive feature allows the thermometer to arrive at an accurate oral temperature reading in approximately 4 seconds. And for auxiliary mode, it can reach that predicted algorithm in 10 seconds. So if you cannot get a temperature or you force enable it, continuous monitor mode operation is normally used when difficult situations prevent taking accurate temperatures in normal mode. Maintain contact with the probe and tissue for at least 3 minutes for accurate oral temperature and 5 minutes for accurate auxiliary temperature measurements. Monitor mode temperatures may not match identically to predicted normal mode temperatures because of the ambient temperature influence and other factors. The following patient actions may interfere with accurate oral temperature readings. These are ingesting hot or cold liquids, eating food, chewing gums or mints, brushing teeth, smoking, strenuous activity, and the readings may be affected for up to 20 minutes after the activity has ended. To gain consent to proceed from the patient, holding the probe handle, withdraw it from the holder, verify that you are in the correct mode, whether axilla or oral, and then push down firmly onto the probe cover to load a probe cover onto the thermometer. And then you want to put it up into the axilla at about a 45-degree angle, ensuring good skin contact, or in the sublingual pockets of the tongue. Now it will do the algorithm, and that's it, just trying to work it out. And after a few seconds you should get a predicted temperature. So for axilla temperatures, there are a few things that affect them. So poor tissue contact, taking temperature through a patient's clothing, you cannot do that. Probe contact with electrodes or bandages, or prolonged exposure of the axilla to ambient air. And then to dispose of your used probe covers, find a bin and press the blue button that has popped up, and it should pop right off, and then return to the probe well. So monitor mode continuously displays the temperature of the probe for as long as the probe remains in the place at the measurement site and remains within operating patient's temperature range. The patient's oral temperature will reach a final equilibrium in about 3 minutes, and 5 minutes for auxiliary. Monitored temperatures are not stored in the memory for recall, and they are taken very similarly to the typical oral and axilla temperatures. You will just leave the probe in place for 3 minutes in the sublingual pocket of the mouth, or 5 minutes in the axilla with good skin contact. Beyond 3 to 5 minutes is not recommended in any mode. Record the temperature before removing the probe from the site, and then when you are finished, eject the probe as previously shown. The temperature range of the device that it can take is 30 degrees Celsius to 43 degrees Celsius. Do not attempt to remove or change the batteries. Return to MESU with a status label for a battery change. The unit can then be calibrated. The unit requires 3 AA 1.5 volt DC alkaline batteries. A single flashing segment on the battery icon denotes a low battery, and an open battery icon denotes a dead battery. Prior to use, check the service label to ensure that the unit is in date, and a unit should be serviced on an annual basis when the batteries require changing. Cleaning, wipe the unit down with green Clinell wipe on a regular basis before and after use, and after each and every patient contact. If required, follow the infection control policy and clean the thermometer and probe with 70% alcohol solution or Clinell wipes. To remove the probe well from the unit, unplug the latching probe connector. Clean the outer surface of the probe well by swabbing the surface with a detergent wipe or with the 70% alcohol solution, or rinse in warm soapy water. Rinse in clean water and then dry external surfaces and allow to drain and dry internally. Don't poke things into the well, that's how they get stuck. Thoroughly dry all surfaces before reassembling the unit and reconnecting the latching probe connector to the thermometer. Ensure that the connector snaps into place. Reinstall the probe well into the thermometer and snap into place, and then insert the probe into the well. That concludes the theory section for the Welk Allen Suretemp Plus thermometer. Now if you go to your local medical device trainer for a practical session.